Looking after the well-being of young people in Africa is a daunting task. It gets more complex on matters that touch on sexuality, gender, and reproductive health. And yet, Straight Talk Foundation has been at it, and leaving behind an indelible and impressive footprint for the last 20 years.
As we commemorate 20 years of the existence of this organization, of course it's also time for us to reflect on what it is that we have done in this organization well enough, or what gaps there still exist. We are doing this at a time when many other organizations have come up doing precisely what Straight Talk used to do alone within this entire business.
After 20 years, I think that Straight Talk is still really holding on to that vision. I think the organization has influenced so many young people, not only in Uganda but in other countries, but also has gone to address young people's needs beyond HIV prevention, and also has addressed given them skills to think about environmental issues, about economic issues. So I really think that the organization has done a lot of work. I should say that it's actually provided an all-rounded information platform. I would call it information and development platform for young people.
I'm so happy with it. I think Straight Talk has grown and expanded in a way we couldn't have thought of in 1993 when I was starting the newspaper. We moved into many different types of newspapers. We moved into maybe 20 different languages we broadcast in. We have a big interpersonal face-to-face, youth clinics and school visits program. We never imagined that in 1993. So of course I think it's done incredibly well.
A few years shy of its 20th birthday, the global credit crunch hit. This saw the dwindling of funds and grants available to programs countrywide. But because of its commitments to young people in Uganda, Straight Talk has re-engineered itself.
This calls on us, or this places an extra burden on the organization to review its methodologies, to review its mechanisms for communicating to the young people.
We have now kind of changed our outlook to the way that we address the concerns of young people. And we are now not just thinking about keeping youth safe until they become adults. We're now looking at making them responsible adults, able to earn a living, able to become productive, and we have now a strong focus on building their skills so that they can live independent lives healthily.
Straight Talk's new form is constituted in 4 thematic areas. These are communication for development, training and development, research and advocacy, and livelihoods and environment programs. Straight Talk has been working with radio since 1999, and by 2012 was producing 25 half-hour programs in 17 languages. These programs were based on content collected by Straight Talk staff and hosted a number of experts, from health workers, counselors and government officials, to teachers, elders and religious leaders. Each program also had referrals where at least 5 health facilities were mentioned, providing HIV prevention, care and treatment.
20 years ago, when we started work in print, we tried to delve a bit into radio, but also we learned that, Ugandans have access to radio and people like to get information through radio in their mother tongue. And as such, over the 20 years, we've had a chance to work with 17 Ugandan languages, addressing diverse health and development issues.
One thing to note is that we have actually reduced the languages from 17 to 12. This was basically because of funding. We were not able to have all the money that would have loved to have to do all the languages we'd love. But we still have the capacity to do all these languages.
We're also looking at having our radio programs put on podcast.
That Straight Talk is a newspaper is a well-known fact, with its flagship Straight Talk and Young Talk newspapers.
So the other strategy that we're looking at is improving on our print materials.
This after the end users raised issues with the existing layouts.
Well, they said, but these papers look the same. I mean, they have good content, but hey, they call it swag, some style, some swag in the paper. So this year we did a redesign for especially the Young Talk and Straight Talk, and that's an audience that you really have to be on your toes to please.
We have received the Young Talk and the Straight Talk, the Farm Talk, and these ones have been helping our students, our young people, to change their lifestyles because their behavior change messages. And we are really very grateful for this kind of service.
In 2009, it went Braille, and with that, captured the visually challenged adolescent.
We thought that Straight Talk's experience and skills could be utilized for them to be able to get that information across to the subpopulation group of young adolescents with disabilities.
And I think perhaps it's the only publication in this country for young people with visual impairment. That's the Young Talk and Straight Talk Braille. Young Talk Braille goes to primary schools and Straight Talk Braille goes to secondary schools. It's been one of the most well-received publications.
Straight Talk's print muscle has attracted other players who've entered into partnerships. For example, Plan Uganda, printing Youth Today and Young Life, and UNICEF, printing Sports for Life, all through Straight Talk. To augment to print and radio, Straight Talk has also embraced technology by going online.
And this strategic plan actually takes care of that young person that does not want to read a paper, wait for the paper. So we intend to have e-newsletters, which we will be putting on our website. So they can be able to get a Straight Talk paper on the website without necessarily waiting.
Young people are daily hooked on Facebook and all other forms of exchange of information. These provide new opportunities for us. That Straight Talk, in its strategic plan, we have recently reviewed the strategic plan of this organization, and we are looking at ways in which we can strengthen the work we do and remain a leader in terms of health communication and delivering messages to the young people and our target audiences.
In the last 2 years, we have also seen us drop a bit in our print outputs. One is also the cost of producing print is very, very high. There's also the high cost of producing radio, but also in terms of approaches that can enable sustained behavior change. You need to constantly keep in touch with beneficiaries through face-to-face contact. Hence the need for us to adopt face-to-face approaches to reach communities.
Basically, training and development is the face-to-face arm of Straight Talk. This department interfaces with our target audience or beneficiaries.
Straight Talk has also faced many other challenges, just like other partners, and this has affected also the trends in which we've been programming. For example, there has been a key focus on HIV prevention among many organizations in this country, among populations that are considered most at risk. And these have been populations we haven't worked with before.
These include the uniformed personnel, the commercial sex workers, the youth out of school, and people living with HIV/AIDS, and truck drivers.
It was important that we spent quite an amount of time addressing these populations because the HIV prevalence rates were not actually going down within these groups.
Ekozire chamani mnonga Straight Talk abo kuba etugwiri twababye bahujire tube turi mu kahuje tube takumanya magara gitu bamwe kugari kanye cyatumye bantorana bakani bandeba bakande bandika amasho sex workers konka hatiya ndi married
atutembee na wabibi zetu ndio zati fika kwa barabara lazima utakako mtu ile watu wa Straight Talk walinipata kwenda nao alikombisa kwa sijatairiwa lakini akampeleka paka kwa hiyo katengenezewa
mezidi ndo tunaendelea tukijaribu kuzuia kidogo na hiyo Wengine wanatumia hata sio sisi peke yetu, hata wale ambao wajui tuko hapa wanatumia kwa sababu wanajua.
Was sent here to tell them, to notify them the dangers of HIV, to encourage them to go for safe male circumcision, and teach them about domestic violence and gender violence.
The truckers now have a place to turn to when in need.
Those who need guidance, those who need some medical services, you know, some come when they don't know the nearest health units, and you find they have health problems. So it's our peer educators that refer these truck drivers to the nearest health units for such health services.
Perhaps the most vulnerable of most at-risk persons are the fishing communities.
Sasa nikasema hii maisha ni magumu sana, nitafanyaje? Nikataka hata afadhali mambo ya kuoleka ivunjike, nirudi nyumbani kwetu. Kwa bahati mzuri watu wa Straight Talk hakuja, tukaenda kwa semina huko Bugiri, tukamaliza huko wiki mzima. Tangu siku hiyo vyenye alikuwa anafanya akaacha. Akaniambia jamani, sikuwa najua lakini nisamehe, tuanze maisha mapya.
The peer mechanism is an important element of Straight Talk's work in training and development, and is used to empower individuals with knowledge and skills to disseminate Straight Talk programs in their constituencies. They receive guidance in effective communication and approaches to conducting peer education.
Starting this year using creative strategies and approaches like peer education, our team has started working aggressively with fishing communities, a bit of commercial sex workers, the men in uniform, to be able to bring the HIV prevalence down.
Yeah, before we received this project, it was difficult because as the local government workers, some of us are not uniformed, and it would be difficult for us to approach the uniformed personnel to sensitize them on issues of sexual reproductive health. But when we had the peer educators who are part of them, then it eased our work. So they are now reached by these services and they are responding.
Put on the thing when your thing is already erect, when the penis is already erect. So you cannot tell me that you can move here to Ginger.
Our officers must know what reproductive health is, first of all. Two, if they've got the knowledge from specifically you, the people of Straight Talk, we tend to interact with quite a number of people. So if we have the knowledge passed on to our officers, we think we can help many who come over to us.
It will be important to strengthen some of the approaches that we're using. The peer education model, where young people are able to reach out to fellow young people after having been empowered, is one of those that needs to be strengthened.
Straight Talk, through EFAP, trained 4 members from our group as peer educators.
I might be a student. Of course, it's my fellow student who has talked to me. So it's very hard for a teacher to talk to a student to understand something. So he needs the fellow student, talk to him. It's very easy. You can have hope.
Actually, it has given me hope. I've known how I'm comfortable where I am. I can live positively and I can do my activities daily as other people who are not positive.
Under training still for the in-school, our approach is the club approach that we have in the schools, where we have voluntary persons come in to establish some kind of social network within the schools that support continuous discourse on issues around health, life skills, livelihood. It's a vast category of issues that they can discuss.
It's also important that we spend a lot of time in building the strength of other local partners.
Where possible, Straight Talk would partner with some of us because the activities were indeed very good, in line with what we are doing, but then we lacked somebody to give us the capacity building.
What seemed to be lacking in our mainstream programming was comprehensive sexuality education. which is a huge, huge gap in the schools, in the families, in the communities, and we are trying to bring this back on board. This has seen us get into partnership with organizations like the World Population Fund, with whom we are collaborating to roll out a curriculum called My World, My Life, supporting us in the schools to work with teachers and students.
And it is the first of its kind, because the issues being raised are issues of reproductive health for the young people. And we have had a problem, especially in the schools which is selected. 10 schools, we have selected them because we also wanted to help the young people. They are living in places where a good number of them have even dropped out of school because of early pregnancies.
Straight Talk works in partnerships and collaborations.
The Civil Society Fund is the new way of work. We earmarked funds within the basket to support Straight Talk Foundation up to the time when we felt that they have learned the new way of work where they have to compete and become innovative.
Why Straight Talk is quite important to us, whether we directly or indirectly fund them. It's because Sweden has a strong focus on the health sector, but in particular in promoting the sexual and reproductive health rights of women, men, but a stronger focus even on young people.
There has been great apathy and denial about the sexuality and sexual activities of persons with disabilities.
So, because no one initially was targeting them, there was that danger.